Welcome everyone. Joe with ECRM here at our diabetes and home health sessions in Kansas City. And with me is Brett from NuCara Pharmacy. And he moderated the roundtable discussion on overcoming barriers to CGM use. So we're going to get into some of the takeaways from that discussion. So thanks for joining us. Thank you for moderating the roundtable. So overall, what are some of those barriers that the buyers and sellers at your table discussed?
Yeah, and we had a couple fantastic conversations around the table. There were two different sessions, and in both of them we had a pretty good cross-section of pharmacists that are on the front lines with industry folks, wholesaler folks, ancillary products, technology people, and so it was really a good free-flowing conversation. Talked a lot about what some of the hurdles may be for upkeep in the industry around CGM, some of the benefits to patients, and kind of ways to navigate the future. So, you know, a lot of it came down to talking about cost and reimbursement and what some of the stipulations the payers have to pay and how there's a lot of patients out there who may benefit but may not be able to check all the boxes that are needed. Talked about patients who have high deductible plans that may not, may have very high costs on them. We did talk about some of the patient assistance programs that are out there to navigate that. So that was a large part of the conversation was, you know, how can patients afford from an economic standpoint to access CGM?
Mm-hmm. Now, were there any specific things that some of the pharmacies were doing in that vein to help them?
Yeah, so a lot of it was helping to navigate patient assistance programs and those copay cards. We do know that there are some over-the-counter options coming onto market. Don't quite know what those are going to be priced at and some of the features around that. We also expect within the next couple of years for some value players to start entering the market, so the costs will probably start coming down as well.
Gotcha. So a lot of this sounds like it's a communication issue. Like there are some things that the patients can access to help reduce the costs of using them. They just don't know about.
Some, and then, you know, even with some of those copay assistance, you know, it still may be $75 a month, which still can be a large portion in budgets. So, you know, there's still economic considerations even at that level with what's available.
Okay, and you mentioned that age and demographics were an issue or involved in some way.
Yeah, potentially. You know, with any sort of new technology, you know, there may be issues with different age groups and being able to navigate that. And a lot of the technology too can sync to smartphones, but not everybody has a smartphone, even though a lot of people do. So there's some of that as well. And you know, you also don't want to be biased and think, oh, just because someone's a senior, they're not going to be able to figure it out, because there's still are seniors who are perfectly capable of technology. Many retirees today used a lot of technology in their careers. So I think people forget about that sometimes too.
Yeah, hey, look, they're all on Facebook now, right?
Yeah, they are.
So, and that's a good point that overlaps a little bit with Robin from Spartan Nash. Her roundtable was talking about the benefits of the data that comes from the CGM.
Yeah.
So, which you can tap into all of that data if you're not using the CGMs first. So this is like a great first step. But also finding out all the things they could do once they have that data to tap into. It's like, okay, this is what we've learned about your issue with glucose. This is what triggers the spike, and here are some of the things you could do. So it kind of works hand in hand.
It does, yep. And you know, with variable glucose monitoring, you always have trouble with getting patients to do it enough to get a good picture. And even then, you know, you'll have sporadic points in time, but it's still hard to put the full picture together. So with CGM having more of a full picture, and the fact that patients don't have to prick their finger 4, 5, 6 times a day, you know, they're changing the patches between 10 and 30 days, depending which manufacturer they're on. It's easier from that regard to maintain adherence, because they don't have to remember to do it as much, and they get prompted that they need to change it.
And that's great. And they can get so much more granular. They could see trends, and okay, if I eat pasta, it impacts me worse than if I eat bread, or vice versa. So everybody's different. So it's good to have those on. Speaking of having that on, right? There's an issue with it staying on, or do people have an issue with the technology itself?
Yeah, some people will, just like other medication patches and things. Some people may have more trouble with adhering of the adhesive. So, you know, there are players in the market, some here at the show that do make options to help cover that up with patches to help it stay on better.
Great, and because you have that catch-22, right? If somebody has diabetes or they're pre-diabetic, you want them to move around a little bit more. But if you're moving around a little bit more, you're at risk of knocking the patch off.
Exactly. Yeah. No, movement's huge. Just in general wellness, we have a definitely wellness issue in large portions of the country. So yeah, I mean, movement is a huge piece in diabetes care, and being able to make sure that patients who are on CGM are able to remain active. And you know, type 1 is where a lot of CGM is used, and so you know there are a lot of, you know, it's not, that's more genetic, not as much tied to lifestyle factors as maybe type 2 can be. So you know, a lot of those folks may be athletes, you know, and being able to use this technology, because athletes are also going to be more susceptible to hypoglycemia. And so the CGM tied to insulin pumps with real-time data, able to monitor what's happening is huge. And you know, I know people in my life who have type 1, and if they go out and go on a run, their blood sugar can tank, and so they need to know that's coming before it happens, so they can either stop running, grab some glucose, whatever it may be, to manage that.
Very cool. And then also you have, with all these connected devices, right, you can have your Oura Ring connected to the, I mean, all this data coming in where you could match the time of day, what you're eating, what you're doing, and sync it all against all of this data with your glucose levels, and really get a good picture of that. So again, really important for people to actually use these things and stick to them. So awesome. Thank you so much. I really appreciate it. And thanks for the moderating roundtable, and thank you for joining us here.
Happy to. Thanks for having me.